when I really started trying to find food from farmers, I started understanding, and a lot of what my parents and my grandparents were saying started coming back to me. And I realized that the way that I was raised was not normal. Was not normal. I mean, when I was a kid, I thought, wow, everybody must have grandparents that farm. I thought that, only to find out that it was gone. By 1984, when I left the Fleur-de-Lis, I was able to make about 30 phone calls a week and have 5 to 10% of my cooler come from local farmers. You know, so I stayed very, very determined. The great news is that 10 years later, in 1995, I started opening a restaurant in Manhattan called Heartbeat. And the concept of the restaurant was a restaurant of well-being based on local, organic, sustainable. In fact, Richie Molinar is in here somewhere. Hey, all right, so Rich met me, I think, in '99 or something like that. Gus Schumacher, who's my co-founder, introduced us. But we were buying from immigrant, refugee farmers. By '95, I could make 20 to 30 phone calls and have 50% of my cooler come from local producers. So I saw some really serious progress. And then the brakes got hit when my son Chris was diagnosed with diabetes. So he has type 1. I have 2 children now with type 1 diabetes. No family history of type 1 diabetes in the Nischan or the Kleismic clan. So there are now environmental causes that are being identified. But the more I studied Chris's condition, the more I learned about type 2 diabetes. At the time that Chris was diagnosed with type 1, which is formerly known as juvenile diabetes, only kids get it. It's where the pancreas shuts down, doesn't produce insulin. Has nothing to do with diet. At that time, there were about 1.5 million kids with diabetes. Now there are about 2.5 million people with type 1. Type 2, which is diet-related, affects over 45 million Americans. 45 million Americans. That's how many people live in poverty. And interestingly, when you look at 45 million people living in poverty, and you look at diet-related diseases, type 1 diabetes, the heart disease, coronary heart disease, a lot of these diseases are diet-related, and we like to argue that they exist largely in these communities. The majority of these conditions are suffered in these communities because of lack of affordable access to the type of food that you all grow here. So it was an interesting thing. I was thinking about quitting. Because here I was, hoity-toity chef, New York City, white tablecloth, charging people 35 bucks an entree, feeling good that I was supporting local farmers, realizing that my type of restaurant represented less than 1% of the industry, and if every white tablecloth restaurant, even this day, tomorrow went farm to table, a lot of them actually lie about it, but if they actually did it and paid the farmers on time, it would barely change the food system. So a friend of mine, Michael Batterberry, the founder of Food Arts Magazine and Food and Wine, said, well, Michel, you can't quit. We can't have that. There's a guy you need to meet. And his name is Gus Schumacher. There are actually a few people in the room who know Gus Schumacher, right? Oh, wow, yeah, a whole bunch. So Gus and I met back in the late 90s when he was still Undersecretary for Clinton. It's so funny. Here's a guy who's supposed to be working on like milk in Afghanistan, and he created the Farmers Market Nutrition Program for WIC and senior families, you know? Here's a guy who's like supposed to be, he's Farm and Foreign Ag Services, right? The #3 post in USDA. And he was working on milk in Afghanistan. He was doing his job, but his crowning achievement was to get those programs into legislation and get them funded. He wanted $400 million a year, he got $40 million a year. So about 20 is evenly split between seniors and WIC families. Gus and I met and started having a tremendous amount of fun. The thing that I loved about Gus was just his youthful exuberance for trying to really get disadvantaged urban communities and disadvantaged rural communities that didn't have access to food together with the disadvantaged farming community. And if we could do this in a meaningful way, we actually might have a better chance of changing the food system than if every white tablecloth restaurant changed tomorrow, right? Here's the thing about Gus. Anybody who was 2 terms the 3rd highest post in USDA that isn't there anymore is making a lot of money lobbying in Washington. The only job Gus has is with Wholesome Wave. You should know that. Here's a guy who could be making a ton of dough, and he's not. because this is what he believes in. So we started doing immigrant and refugee farming community stuff, introducing immigrant and refugee farmers to heirloom farmers in Massachusetts, and introducing them to chef friends of mine in New York City, really big name chefs, buying directly, providing two-year contracts, paying every couple of weeks, turned into the New American Farming Initiative, which eventually kind of got handed over to Heifer International and turned into the New Immigrant Farming Initiative. Gus was a brilliant, brilliant guy, but we were doing this as a hobby. So eventually somebody told us, you should just found an organization. We ended up doing about 7 or 8 programs, projects, would have an idea, find a nonprofit, find a group of farmers, put them together, do the thing, turn it over, hand them the keys, and there they went. So we founded Wholesome Wave in 2007. And Wholesome Wave's mission basically is to provide affordable access to locally grown agricultural products and create revenue streams for small and mid-sized farmers. Introduce these two communities to each other. The 3 programs we have, I'll talk mostly today about the Double Value Food Coupon Program, but we have Double Value Program, the Fruit Vegetable Prescription Program, Healthy Food Commerce Initiative. The Doubling Program, many of you might know it in here, you've heard about it. Roots of Change has been doing the program here in California with some specialty crop money. It doubles the value of food benefits like SNAP, which is formerly known as food stamps, WIC benefits, that's Supplemental Nutrition Assistance for Women, Infants, and Children, Senior Farmers Market Nutrition Program benefits, SSI. We double those. We basically don't believe we should be restricting anything in neighborhoods where people only have access to highly processed foods. But we love saying, buy whatever you want with them, they're food stamps, but if you come over here, we double your money. The Fruit and Vegetable Prescription Program, we raise private money to deploy through doctors and nurse practitioners in underserved community health clinics enough benefit so that the doctor can prescribe enough fruits and vegetables to an entire at-risk family to raise their consumption, a serving per day of fruits and vegetables. When the family comes back every month to get their prescription back, they have to get measured for health outcome. There's a policy target there. Everybody knows about the Farm Bill, but very few people think about how Title VI of the Health Reform Bill, Section 4013, can potentially steer billions of dollars towards the small and mid-sized farm economy. We're only going to get that money if we can prove that food is measurable prevention. So that's that program. And then the Healthy Food Commerce Initiative imagines what would happen if through the Farm Bill we're successful getting incentives into the SNAP program for fresh fruits and vegetables locally grown. What if we do that? What if we steer Title VI money through healthcare insurance companies and health providers to provide people with locally grown food prescriptions? The food businesses don't exist to handle billions more dollars in this type of activity. So I talked, Hallie and I were talking, she was, is it Hallie or Haley? It is Hallie. Oh, God, I got it right, 2 L's. Anyway, they're putting a processing facility on their farm. We believe that there are many, many processing facilities missing of the size that can actually save school food. There are 167,000 grade schools in America. And if anybody thinks for a second that anyone's going to pay for the average of $70,000 to do the infrastructural improvement in all of those grade schools so that they can actually cook food from scratch, that's tens of billions of dollars right there. And then you have to add 1 to 2.5, depending on the size of the school, employees, even at $12 an hour, which is not a living wage, with no benefits, you're looking at another $20 billion a year in salaries that have to be paid. It's not going to happen, at least not now. But until that happens, the role that the farming community and the food processing community can play in changing school food is there. So this is the supposition that we need to look at value-added processing facilities, aggregation facilities, distribution, online platforms, all of the technologies that are available. So the $5 billion in Treasury money right now that's supporting the notion of big box grocery stores and food deserts, we think that there are better targets for that money, and it includes farmers. Anyway, when we started, we were in 3 states and 8 markets with the doubling. And it was so popular, we said, oh boy, we better have a strategic plan, because it was me, Gus, and Christina Sandolo at Wholesome Wave. So we imagined that in 5 years we'd be in 10 states and maybe 50 markets. Today we're in 28 states with 50 plus nonprofit partners, over 325 markets. So we deploy, we don't go in and hang our shingle in a community. We find really talented nonprofit organizations like PCFMA, like ALBA, like Experimental Station in Chicago, like Farm Fresh Rhode Island. We find nonprofit organizations that are serving farmers and are concerned about people in underserved communities, understand the lack of affordable food access, and we work with them to share innovations, create learning communities, get them some dough, get them moving, some of them helping them with grant writing assistance to get more money. I think last year we leveraged somewhere around $1.5 million in FMPP and specialty crop money for our partners. We don't take any public money, just so that you know that. So anyway, we deploy through these partners, but that's a lot of growth. You know, and it's pretty interesting. Kathleen Merrigan was doing her Know Your Farmer, Know Your Food thing yesterday. Does anybody remember when they had their strategic plan and they said they wanted to get EBT, which is SNAP sales at farmers markets, from 4.2 million to 7.5 in their 4 years? She announced yesterday that last year, in 2011, EBT sales at farmers markets was $11 million. Nice, huh? Yeah, pretty cool.